in an African home, when you refuse to take the medicine that is going to cure you from a particular disease or health issue, someone is assigned to speak to you, someone that you trust.
Hi, my name is Harriet Tinker with Diversity Community Newscast. And today I am absolutely excited to have a panel of guests today who will be talking about our favorite subject, COVID-19, which seems to be the most popular topic these days.
Have individual dialogue with some community members that are hesitant to get vaccinated for one reason or the other. It goes from, oh, somebody told me that if you get vaccinated, there is a chip being implanted into you, or somebody in my church said that, you know, they don't know the future ramification of it. So therefore, so that this is where I have a candid, really candid, basic conversation with the person. I say, okay, so you are worried about the future, but what if you die now? You won't have the future to worry about. But at least if you get vaccinated now, you protect yourself, you protect your children, you save, you know, if you die, who's going to take care of your children? And on and on. So sometimes this is where we go back to those basic candid discussions and say, yes, I will not debate what they've heard. What I would talk about is what is real for now.
Yeah.
Because I don't know the ramification of the vaccine in the future. I can't say that we're all going to die at the same time or we're going to live forever. But what I can say is that for right now, if you get sick, it will affect your children, if you affect your earning powers, and if you die, what's going to become of your children?
When you talk to people on the ground, they tell you the real problems. And it blows my mind when you take these feedback from the community and try to present it to authorities at the top, they dismiss it. Blows my mind as to why that happens very often. I don't know. During the pandemic, when government brought up programs to reach those who need help with food, and they realized through their own data, not data generated by the racialized communities, through their own data that they generated through the big organizations, that of all the Africans in Alberta or Calgary, and Alberta was less than 10% were accessing help. Okay, and they kept asking why, and they were coming up with two theories. Oh, it is information. We need to put information in different languages. When they called us, it took a minister, Mr. Rajan Soni, said, no, we've done this and we are getting the same results. Something is wrong somewhere. Called the community leaders and said, what is the problem on the ground? And we just give them the blueprint. First and foremost, people from Africa and other countries don't beg for food.
Mm-mm.
When I am hungry, it is my neighbor next door that knows I am hungry. They will cook and bring me food. So if you're leaving a 1-800 number that somebody should call and get help, is not gonna come. Let us trust us, let us get food to people who need it. We know how to do it. And then the whole argument about trust and to organization, who should we give the help to? And these organizations are stuck in their old ways of doing things that do not work for the immigrant communities because they work differently. Culturally, they are different. The way they relate is different. It is based on trust and respect. And if you don't have the trust and the respect, forget it. Nothing is going to get done. They trusted us, give us some, I would say, 100th of the money they've been doling out to these big organizations. And within 2 weeks, we were 7,000 and upon thousands of families with food and much needed help. Okay? When it came to the vaccine, the same thing. All we heard was an announcement that $4 million has been given to this organization. $5 million has been given to this organization to do vaccine drive. And I just went like, oh my God, they did the same thing again. They did the same thing. That hasn't worked for community. They did the same thing again. So we have to push. Now, it will interest you to know that we got $30,000 to do vaccine drive. $30,000 for the entire African community in Caribbean. 30,000. And even that, it was the minister who had to push and push and push and tell them that we don't bypass this. And as I said, we had clinics at Ikram Joma, we had clinics at the other mosque, we had clinics at Somali Center, and people came out and got vaccinated. And I told the minister, now you realize that the communities know how their communities work. So you need to give them the resources and empower them and allow their leaders do the work. Vaccine clinic, coordinate with an imam. Tell the imam, we want to come to you. How do we get your people vaccinated? He is going to tell you how it's going to be done, and it will be done. Get to the grassroots organizations, give them money to organize campaigns, to get volunteers, to send messages out that this is in our community. Come out and come and get help. Honorable Shepherd, I don't know how many times I have to say this. It is frustrating. It is infuriating. It is demeaning that you cannot trust African organizations with $1 million to get the work done, but you can trust another organization with $10 million to get nothing done. Mind-blowing. So these are practical problems that grassroots organizations in the end that are serving the communities are facing. They have been starved of financial resource help. So they are not able to even get involved. They always bypass them. They don't get them involved. They don't seek their opinions until when they realize that all that they've done does not work. Then they come back to us looking for solutions, looking for ways. Before they started the hotel thing, quarantine, they came out and I told them, do you know in immigrant homes, how many families are there? Okay, we have grandpa, grandma, dad, mom, kids, cousin, and maybe a visitor. Okay, so if dad is positive, he has nowhere to go. He's an immigrant. He has only one place to live, his house. Can you allow these people to isolate in hotels? We kept drumming this and drumming. Finally, they saw that, oh, this could be helpful. They started implementing the hotel isolation, and instantly they saw numbers plummeting in the racialized communities. So the solutions are there because they are not identical to what they are used to. They always dismiss them, and that is problematic. That is problematic. So I'm letting you know this, and when you're talking to your colleagues, let them know that the grassroots organizations have solutions, practical, tried and trusted solutions to get a job done. And most of the things that they've not been able to do, grassroots organization will deliver on them. Thank you.
It's really amazing because the solution is there, but yet ignored, right? And it may also be that because there's no formal, research, documented, evidence, around that. But right now, there's that opportunity. You can see the evidence all over the place. All the criticism, that went through to Dr. Henshaw was based on a lot of research, and all that this may not work. I've not heard anybody saying this will not work, but it's a gamble that the government has taken. Let's hope, cross our fingers that that gamble is not going to result into, something. So I don't know. I think looking at the future, I'm actually more interested in what are we going to do, right? Going forward. We can't look back anymore, but what are we doing going forward to set the stage, for success, to prevent something like this from happening in future? I think that's where I see where we should put our efforts, right? To make sure that, communities are safe.
As much as we want to be rid of it, and I do as much as anybody, I want folks to be able to go back to normal lives. So as others have observed, what is normal has probably changed. So, but we have to recognize that we still have more to do, that there are still people and communities and individuals who are risk. There's still things that we need to learn. So again, the decisions that have been made recently, they concern me for that reason, as it just feels it may be just too much of a rush to try to put this behind us without having properly learned the lessons and taken the steps to ensure we are protecting everybody, and recognizing indeed that, for example, as Charles said, racialized communities have been hit harder. They are struggling. Women were hit harder economically. The impacts have been disparate, and I'm concerned that in a rush back to normal, we are going to lose the lessons we have learned about those who need help and systems that we need to change in our government and in our society. I really appreciate what Moji had to say about what we have learned about innovating, learning, and adapting. And indeed, that has been the case for so many during this pandemic. Indeed, we've had many that have been impacted and have needed additional help. We have had many that have been able to adapt, use resources that were available, indeed groups that have supported each other. And as she said, really important that we take the opportunity to learn from that, rather than, again, rushing ahead to try to just reset everything. Make sure we have learned from what we have learned from the folks that have found new ideas, new perspectives that we can use. And indeed, that is what Sam was saying as well. You know, he talked about this being a bit of a gamble, what the government is doing, and indeed it is. And we have to look at who is at most at risk if that gamble does not pay off.
We actually don't know much. We don't know much about it. And they also, I don't know if they've done enough research into it, but I'm thinking it's better, like, for all of us to have that vaccine so we can be, you know, fully protected from the virus. It wouldn't be nice, you know, like you are hearing all these cases of people who are not vaccinated. They are ending up, you know, in ICU. They are filling up the beds, which is resulting in other people who have other, you know, like sicknesses which need to be attended on, or maybe who need major operations or cancer operations. They are being postponed, and then they are ending up dying just because of this. So I think if we all get vaccinated, I believe we can protect each other and we can save lives. I believe the vaccine is safe. I mean, they have done enough research, I believe. I think it is safe. I think we should all take it.
I have a grandnephew that has ended up being positive at 8 years old, COVID, in the last 2 weeks. But I have his father who does not believe in vaccines and refused to have his child vaccinated, not even when he was born, and having all those other tests done. So that is part of where my anger is. And it's part of where I would love to be back in Hamilton to grab my nephew and just pound his head a little bit for him to say, come on, son, open your eyes, your child is ill right now. So I think what we need to say to others who don't believe in vaccines or think that this is not working or will not work is that they need to look at what is out there and think about it. And I think, Harriet, you made some mention about shingles, and you think of all the measles, you think of the mums for children, you think of all the thing else that is going on out there. And for that reason, I feel that all these people that are out there saying that vaccines create autism in children, vaccines does this, vaccine does that. We have seen that vaccines save lives. And in saving lives, I just want them to stop and think. They would not have a grandmother or a great-grandmother around now if there weren't vaccines that were out there to save lives. And if people get angry with me for saying this to them, so be it. I will still continue to say, stop and think about what you're saying to others that will create an issue. Vaccine saves lives.
I want to take the blame from individuals who are hesitant in getting the vaccine. I would like to put the blame on the community that have not put in enough effort, because let me tell you something. We are Africans. And quite often in an African home, when you refuse to take the medicine that is going to cure you from a particular disease or health issue, someone is assigned to speak to you, someone that you trust. But we're not talking about scientific evidence now. We're talking about trust. And that's the issue with the vaccine. It is about who is telling me that it is good. Sometimes if you refuse to take a medicine from your mother because it's bitter, your mother sends you to your uncle, your aunt, or your grandmother, or your grandfather, someone you can trust. And the grandmother will tell you, my son, please go and take that medicine. It will make you feel better. Please take it for me. Okay, so we have to reach out to the people. It's not enough. You can bring all the doctors you want. You can bring the best scientists. Do we trust who is telling us to go get it? That's where the issue is. So we must be able to assign a community that have come to some understanding, use the people in the community that we trust. For example, most Africans trust their pastors and their imams. Where are they? You can bring all the doctors you want. If your pastor stands on the podium and make reference to this pandemic in historical context, in religious context, in spiritual context, I'm telling you, we won't be having this discussion. Most people will go and get it, but we're not doing that. You can have all the nurses coming to say, go get it. You can tell, listen, when somebody don't trust you, it's a very difficult thing to deal with. So we must deal with the issue in our community. Why is the Black community not trusting? Because we have to diagnose that. It's not enough to keep pushing, go get it, no. It is more about how do we get them to trust us and therefore to obey. So we cannot solve the problem if we have not diagnosed. Why are we hesitant? And all the data shows that Black people are suffering from the COVID-19 more than any other. We need answers. Is it because of our melanin? Is it the food we eat? Is it our genetics? What is it? So there are things that we need to do to bring those people who are hesitant in line. But to continuously saying, just go and get it because people are dying, there are people who will choose to die than to take something they don't trust. Now, do you hear what I'm trying to say?
Mm-hmm, absolutely.
There are people who will choose to die than to take something they do not trust. So we need to use the word trust. And that's what I say, grandmama can do good. Because when grandma say, my son, drink it, I drink it.
Absolutely,
but grandma
I agree.
is not here. So let us reach to the people in the communities. Well, most of our community leaders, we seem not to trust them. So let's go beyond that. And that's why I mentioned the churches. Are they preaching the sermon of survivor, the sermon of pandemic, and what it's doing to our community? Those people, I'm disappointed that they are not on the platform preaching this sermon. The sermon of survivor.
We have our newcomers or refugees coming from parts of, I'll start with the people coming from certain parts of Africa. They are very hesitant to get vaccines. There's a lot of historical reasons why they do not trust, not the vaccines per se, but I think the whole sort of medical or healthcare system. In the past, I think many of us here come from Africa originally. There was some, how should I put this? The vaccines or things taken to the continent of Africa were not exactly positive things. So vaccines are, some people, especially the older, I think, African refugee immigrants, look at this as yet another thing that's being pushed down their throat. That is exactly, they query it, like what is the good or the intention of this vaccine? Now, when they tell us this, we say, well, I would say openly that I've been vaccinated, being a healthcare worker, and I know many African people have been vaccinated. So this was not made or created to intentionally harm them. So that's the one lot of people, and I can expand on that later. We then have those who say to us, oh, this vaccine was made in a hurry. How safe is it? That's I think a very common thing and cuts across all ethnic sort of backgrounds. And our response is that the technology behind this vaccine creation has been in existence. It's been used for things like rabies, for cytomegalovirus viruses, for other viruses. So the technology was in existence. And I said to one lady, it's like someone makes dough or puts together cake mix. And then someone comes along and says, well, I could do a cake with this mix, or I could do a muffin, or I could do a cupcake. But that technology was in existence. And from it, we then came about with this vaccine. So it's not necessarily new. There's that lot. We have the lot that says, we're young. We're young, we don't need this. Maybe if I'm old, I've seen old people dying from COVID. I'm a young person, I have my immunity. And we say to them, no, actually, this virus is different. Whether you're young or not, you can get it. It's very contagious. And then you can pass it on to somebody else who's even older or more vulnerable, has got more vulnerabilities, and that person can get very sick or even end up in ICU, even die. So there are quite a list of things that people say out there, but those are three of the things that sort of jump out at me right away.
Processes in place that were there, and because, yes, it was done rapidly, but because of these structures that were there before, it made it easier for it to be done effectively. I've gotten my 2 vaccines, and my daughter has had 2 vaccines. My wife has got 2 vaccines. It's just that my 10-year-old can't. But vaccines have been proven over the years, over 100 years, to actually help. But one of the things that social media has played a huge impact on how people are accessing the vaccine, because people are listening. And then today, people have WhatsApp, and they can access information on their phone, and one video is circulated over and over and then edited or added. So this misinformation on social media has played a huge role in people. And when we look at the 25% that have not been vaccinated, and the Africa Center has been one of those hubs that have been helping the Black community to get vaccinated.
I also support, the vaccine, in a sense. For me, what I watched first when the vaccine came out, with all the information that were out there on the internet and everywhere, people were talking all kind of things about being killed. It's 666, it's cheap, it's this. You just name it. So personally, I sat down and looked at it, and I said, okay, the vaccine is out. A lot of people said before, it's taken years for vaccine to come out when there is an outbreak of anything. And why is this so quick? And I think I did my own research into it. I listened to people, and I got to realize that since the outbreak of SARS, they've started working on, on a vaccine for coronavirus. So I realized that. And the other thing that actually, quickened me to take the vaccine was when it came to Canada. The good thing was it was being administered to the old people and the frontline workers. And I think I paid attention to what was going on there. I realized that after the vaccination was successfully administered to the old people, hospitalization, transmission, death went down. And I don't think any doctor or any scientist will tell me more. It tells me that the vaccine works. So based on that, I went and I've already taken my second dose. And I encourage people, And one thing I don't do is anybody that has a different views in arguing it that is not good and things, I don't argue with you. I will ask you to get more information from professionals, or if you're looking one-sided for your information, I would advise the person to be open-minded and try to protect themselves, because I've seen where people take vaccines in the past, including myself when I was younger. There were a lot of, I would say there are so many of those disease that I never had until now. Why? Because my parents vaccinated me. And at least I understand vaccine work. I think these are the things that we have to teach most of our people. Unfortunately for us from Africa, I think one thing that is blocking us is a lot of our people who were in the villages. They didn't have the opportunity to be vaccinated, so they're not used to it. They don't know it. They don't have the education. And finding themselves here today, even in Africa, when we call people, they've never had a vaccination because some of them didn't have it when they were little. So for you to convince them that you have to take this, I think they listen to different kind of sources. And I hope at the end of the day, as we do have our Dr. Njenga here, they will be able to, pass a very good message to people to understand that it's something that they need to take. Thank you.
It's very safe to get the immunization. Is safe, and it's safer to get immunized than to get the disease. For me, the vaccines, it really help. It will help fight what's wrong with your immune system, what's wrong with your body. For me, it really helped. I remembered when I took my first dose of Pfizer, my left arms was very sore, and I have not really a bad side effects about the vaccine, but I have a sinus. But I knew I have the sinus. I grew up. I'm from Haiti, and I left my country when I was 13 years old, and I spent 9 years in United States of America. So I have the sinus problem, but I never take it seriously. And then I never know if it was that serious. I never treat it. So when I took the COVID vaccine, it bring it up because I have it in me already. So I finally treated. So when I took the second dose, I was fine. I felt very well. My arms is not even sore. I didn't have any pain, no fever, no headache. So I think it's good. It's really worked. Yes. And I have the sinus. I manage the symptoms. I get a lot of medicine, a lot of nasal spray. It blocked I have stuffy nose, running nose, sneezing for 3 days, and after it's gone. And it's very amazing to see the virus. It's a pandemic, and it's a breeding problem and all around the world. So now they finally bring a vaccine to help others. And it's nothing wrong with the vaccine. I try it on me. I think if someone took it, if it showed bad side effects, it's because you have something, the vaccine find in you that it's gonna help you.
It can be quite a sensitive topic, a sensitive issue that it's quite divisive, but I think one of the biggest reasons why we don't have, or there's hesitancy for the vaccine in our community, whether it's African, Black, Caribbean. I think Black people are a highly spiritual people. So sometimes there's an understanding that acceptance of the vaccine is a rejection of whatever higher power a person believes in. So from the people I've talked to, people who are not willing to get the vaccine say things like, Jesus is my vaccine, God is my vaccine, God will protect me. And those things are cool and important. I would never want to take that from any person or undermine their faith, but science has its place in faith spaces too. So yeah.
History of mistrust within people of color, and rightly so. So I want to acknowledge that. So I think that is some of the fuel behind the hesitancy. But another thing I was just thinking of right now is that in some immigrant communities specifically, there is this feeling in Canada of like otherness. Like they love Canada, they're grateful to be here, but they feel different than other people. And so I think that sometimes when you don't identify with like the major group, you think things don't apply to you. You think you don't need the vaccine because you're different. And so I think there's that disconnect between identifying with all Canadians can contribute to the hesitancy to participate in vaccination.